There were many issues identified related to ASD and ADHD. One of the first issues was parental perception, beliefs, and cultural effects on ASD and ADHD treatment. There are no specific laboratory tests or diagnostics that can be done for ASD and ADHD. There's just the screening tools. Some of the characteristics like eye contact, lack of eye contact, interaction with strangers, age, speech begins, these can all be subjective. Some parents may not find a lack of eye contact a problem based on their cultural backgrounds. Parents may also discipline their children differently based on their beliefs, their spiritual values, and their cultural, and a lack of discipline could result in the child's increased hyperactivity and behavior. Additionally, some parents don't voice concerns over these problems that they don't find abnormal. The parents may hear that their child has a diagnosis and they go through a grieving process, they're in denial, and they don't want to participate in treatment. It's important for providers to anticipate these responses so that they can adequately support the parents in the process of the diagnosis. Diagnosis can also affect the patient's and family's quality of life. Sometimes parents have to spend more time with the children who have these problems, meaning that their other children don't get as much time and attention. Um, Researchers have found, though, that there are many coping styles that significantly contribute to a more positive mindset. Um, Providers can greatly assist families by anticipating the coming stress. They can provide coping skills in advance to help the families identify their social support, their source of strength, and reach into their faith background to help them deal with the problems that they're going to be dealing with. Providers need to be adequately educated when counseling parents. They can look towards the Autism Speaks Foundation to help find resources for the parents when dealing with the diagnosis. Food selectivity, aka picky eaters and mealtime behavioral problems, has a significant effect on the child's nutrition when it comes to ADHD and ASD. Um, Different strategies can be utilized to help parents increase the types of food their children eat and consequently improve the child's nutrition and decrease these mealtime behavioral problems. Follow up care and team coordination has been seen as an issue. Primary care providers oversee the treatment, but they have to place referrals to dietitians, speech, and behavioral therapists. The school system is also a big part of the treatment team and children with special needs. Unfortunately, in most cases, there's no good communication channels in place for the school to communicate with the providers. The Children's Hospital of Philadelphia did attempt to implement an electronic portal to enhance communication, but unfortunately, there was a lack of consistent use, and the teachers felt that they couldn't use it adequately based on stringent policies that were in place. Care consequences of low-income families is also an issue. Some families obviously have a lower income than others, and this can affect the type of food that they can buy. Researchers found that minority children and children in low income and rural neighborhoods were most affected because they had increased access to fast foods and nutrient deficient foods and had decreased access to supermarkets with healthy food options. Children also received a lot of their nutrition in the school setting, and were less likely to receive optimal nutrition from school meals. If parents don't adequately communicate to the schools as to what their child needs to be eating, then the child can increasingly eat poor foods. Many parents also return to the primary care office reporting that they haven't even gone to the referral because they didn't have a ride or they didn't have childcare for their other children, so they just didn't go to the referral appointment. Missing these appointments creates difficult obstacles for the primary care providers to overcome, as well as frustration for the missed opportunities for other people in the community to come into those appointments.